Congratulations, you've just passed OET or IELTS academic. Now you're thinking about maybe working overseas. That's what this video is all about. Are you a specialist? Do you want to specialise in surgery or geriatric or gynecology? Maybe you are a GP and that's what you want to keep on doing. Whatever your passion, there's a number of obstacles to clear before you can organise your travel plans and start work in Australia. Your qualifications and experience are assessed. This is called the comparability assessment. Now, overseas medical specialists, they need to do this with their specialist college. And listed in this text box is a whole range of specialist colleges operating in Australia. Your qualifications and experience need to pass this for specialists, and if you're a GP, you need to apply for this comparability assessment with the Australian Medical Council. If you're overseas, you might need to go through the Education Commission for Foreign Medical Graduates. And both specialists and GPs need to pass the AMCQ number 1. Now, if you're a specialist, there'll be a further lot of documentation you have to fill in from your specialist college. Lots of complicated forms. One of them is 12 pages long, and you can't get out of this. You've just got to go with the flow and do what they want you to do. The AMC also needs to look at your credentials, your certificates, your experience, and make sure that they've all been notarized. If they need translating, the translations come with they've been translated into English and notarized by a notary public in your country. Yeah, the OET is not an easy test to pass, but it is really the gold standard and for medical people. And this is because in the OET, the writing and the speaking are actually discipline specific. So if you are a nurse, you'll be given a nursing case study to write about and a nursing role play to perform with a role player. So after you've been through all those form fillings and comparing of your comparability assessment, it's now time to get a job, to find something in Australia which would suit you. Now, this is not so easy because there is something called the Monash classification system, and this divides Australia into various states. The states are then divided into zones, and you will need to choose a zone that's something close to a zone 2 up to a zone 7. Of course, when you find jobs that are available and say, yes, I could do that, you will, of course, have to apply for them and fill in a resume with a covering letter which would be addressing essential criteria, and hopefully you'll get a job interview offer of an interview, which is normally done online. So the job interview is arranged by your potential employer. This is called the PESCI, the Pre-Employment Structured Clinical Interview. And it's conducted on Skype or Zoom or Microsoft Teams, whichever one's easiest for you. And if you ask, usually ask anything between 30 minutes to up to about an hour. There'll be a panel of people who'll be interviewing you for the position, and then they go away and they talk about you, and they might decide, yes, you would be able to do this, and they will send you a letter of offer for the position. So at all times during this pesky test, you need to be confident, knowledgeable, show that you're adaptable, and you've got good spoken English. So let's say you've got the status of comparability. It's been granted by that specialist college, or you've been approved by the Royal Australian College of General Practitioners. So now you are able to go ahead and ask for limited registration with AHPRA, Australian Health Professional Regulation Agency. AHPRA is the umbrella for all the specialist colleges. So you can work in Australia with limited registration, but only for a maximum of 4 years. But if you go on and do the MCQ number 2, that limited registration is lifted. Now the MCQ2 test, it's a series of stations in a hospital setting. Now it won't actually happen in a hospital, it might, but so you're asked to, what would you do in this case? Could be some sort of oncology thing, cancer patient. You then move through to someone who's got gastroenterology problems and so on. So the MCQ is really a very good test of your understanding of medicine. AHPRA likes you, so they're going to provide an in-principle letter and send that on to the Australia's Department of Immigration. And you'll get a copy, of course, emailed to you that they've done this. That means once the Department of Immigration has got that letter of in principle from AHPRA, now you can actually go ahead and apply for your visa. And when you get your visa, of course, on your passport, it's time to start thinking about leaving and booking that plane flight and coming out to Australia. The visa that's normally given as a 482, but in specialist cases it's another sort of visa. So you do need to go through a registered visa agent. And all of this can take quite a long time. It can take between 6 and 12 months to get everything organised, to get to the point where you've got your visa on, you're stamped in the passport, they're expecting you to take up a job in Australia at a particular time, and so on. And the OET workshop, we've been helping people pass the OET test and IELTS test. We're branching out, and we've actually, for the last couple of years, we've been helping the occasional doctor with his or her migration journey. So we are now offering this as an extra at the end of all the OET or IELTS preparation for those of you who might want a little bit of help with putting together letters of a covering letter, even putting forward your resume, putting that together. And we can certainly help you find suitable positions available in the correct Monash classification zone. So we can help you with all of that, and the details of that product are on our shopping cart. The link is on the screen. All right, good luck with all of this. Yeah, it's quite a journey.